Those 5 practices were there then, they're timeless, they're still here today, and they're universal. It is a highly regarded designation, absolutely. Less than 7% of the hospitals in the country have that designation for excellence. The real reason that St. Vincent pursued the magnet designation is because it's the right thing to do for our patients, for our community, for our associates, and for the organization as a whole. Because what you get are better outcomes, and that's why we're here in the first place. And then we also know that when you have better outcomes, there's a ripple effect where you have better reimbursement, better retention of quality staff, physicians who might look elsewhere because of the quality that we would have, they would want to be here. Every physician wants to be where they know their patients are going to be well taken care of. It's always an appeal when you can work with something that provides the data. And Pat always says the person with the data wins because you have evidence. So it is important, and I think the other thing that was really important for us in selecting the leadership challenge and the 5 practices is because it fit so keenly with our values and our mission and what we're about. So when you put that together with having the data that supports doing it, it kind of was a no-brainer for our executive leaders to make that decision.
Modeled Way, I think, was a very important part. It kind of started all of the leadership practices. Sally and I and nursing leadership really had to establish the credibility, the integrity. It was up to us to model what professional nursing practice looks like.
One of the 5 practices is inspire a shared vision, and it was critical that we were able to do that because people need to know, why would I do this? Why do I want to be a part of this? And we ongoingly tried to inspire a shared vision, but at the same time we tried to enable them to act. Enabling others to act is one of the 5 practices. And some of the ways that we did that, again, we shared the history of Magnet, what it looks like, what it could be. We gave them lots of tools to work with, and we provided them online on a shared site for our Magnet champions so that they could communicate and educate other staff along those lines.
Not only through our Magnet champions, but we had to establish an entire system of shared governance, and that particular program allows nurses at the bedside to make autonomous decisions around their nursing practice, their professional development, and the quality of care that they give to patients.
Innovation is one of the ways that we've changed how we work. The other is through evidence-based practice, using evidence in all that we do. So when we're making decisions and we're planning, we have to make sure that we're looking at what evidence exists to support what it is we want to do.
I think the innovations that Sally talked about lend themselves to challenge the process. Mm-hmm. Staff being able to take risks, to try new things, to do research, share that research through professional organizations and conferences. And so that really we've seen professional growth and staff being able to take those kinds of risks to be able to challenge how we do things.
We also encourage the heart by celebrating at every opportunity and recognizing folks for the work that they've done so that they know this is it. This is the kind of work that a Magnet organization does.